Hello friends, in today's video I will be going to present a live demonstration of central line placement. In this case we are using hemodialysis catheter instead of the central line because this patient is going to have the hemodialysis. So all the steps and the procedure are same as the central line placement and the sites are also same. Just we are using the HD cath instead of the CVP line. Before going to do any procedure in the ICU, you have to take the written consent. While taking the consent, you have to explain all the step and the related complications of the procedure to the patient and the relative. And this procedure should be done under all aseptic precautions with continuous vital monitoring. It can be simply divided in a 4 steps for your simplicity. The first one is the assessment of the patient and look for investigation. The second step is the give appropriate position to the patient for your convenience, and the third one is the preparation of the trolley, and last one is the main procedure, that is the insertion of the catheter. The first step, the assessment and the look for investigation. Always do assess the patient before going to do the procedures. You have to assess patient for the appropriate site. There are possible 3 sites. That first one is the subclavian vein, second one is the internal jugular vein, and the third one is the femoral approach. The femoral approach is the most easy way and it is a compressible site. If you accidentally prick the femoral artery, you can compress it by giving a pressure, but it is not same in case of subclavian vein. It is most non-compressible site and there is a high chance of development of hemothorax if you prick the artery. In this video, I have shown the catheter placement through internal jugular vein. The right side internal jugular vein and the right side subclavian vein are the most direct pathway for the right atrium via superior vena cava. Second step, the position of patient. Ideally, the 15-degree Trendelenburg position should be used if feasible. Otherwise, you can use supine position along with the little bit neck extension, for which you can use the bolster and the sandbag below the shoulder. For right side internal jugular vein and subclavian vein, tilt the head to the opposite side, that is left side. Third step is the preparation of trolley and the equipment. You can see this is the hemodialysis catheter. It is of 11.5 French and double lumen catheter. It is sterile, completely sterile. Take it on the trolley. It contains 2 sterile Z-dress along with this double lumen catheter and introducer needle and 2 dilator sheath. One is small and one is large, and 2 stopper, and this is a J-tip guide wire. On the trolley you will need 2 bowl, one containing heparin with NS, other containing plain NS. First, remove the air from the catheter and the dilator sheath so that the air will not enter directly into the bloodstream, so air embolism will be prevented. Then check the guide wire whether it is working properly or not. It has J-shape one end and there is a marking over it after every 5 cm. You can see that black color marking. Along with this you will need the suture material, scalpel with blade 11 number, and needle holder, scissor and sponge holder. Also you will need 2 5 ml syringes and 1 2 ml syringe. After giving proper position, clean the area with antiseptic solution and cover it with sterile linen, and before that you can use skin marker to mark the site of puncture. After painting and draping, give the local anesthetic lignocaine 2% at the site of needle puncture and wait till the anesthesia will act. Here I am taking right internal jugular approach for catheter placement. Ideally it should be done under ultrasound guidance, but if not available, can be done by using anatomical landmarks. Till anesthesia will act, we'll discuss the anatomical landmark for internal jugular vein access as a central line. Anatomical landmarks are more important. If you know it properly, you can do the procedure very confidently. In the case of internal jugular approach, you should know the anatomy of anterior cervical triangle. It is formed by anterior border of sternocleidomastoid muscle laterally, midline of the neck medially, and inferior border of the mandible superiorly. That means it is inverted in shape. Apex is downward directed, and this apex is the main landmark for the needle puncture. It lies nearly 5 cm above from the medial 1/3 of clavicle. Inside the triangle, internal jugular vein lies nearly 1 cm lateral to the carotid artery, so that palpate the carotid artery and go nearly 1 cm lateral to it. You can see in this video that I have palpated carotid artery and then introducer needle is inserted lateral to it by negative pressure. You can see this. Slowly, slow movement you should insert it. Needle should be inserted at about 30 to 40 degree angle to the skin at the apex of the triangle and directed towards the ipsilateral nipple, that is the same side of nipple. Then after confirmation of needle inside the vein, you have to insert the guide wire. The J-shaped tip should be inserted. Never use the other end of the guide wire. And you can see on the monitor that heartbeat will be increased. Remove the introducer needle by keeping the guide wire in position and pass the small size dilator sheath through guide wire and take a small nick with the help of 11 number blade. Then pass large size dilator sheath, and remember it should be inserted by rotating movements, not by the pressure. You can see in this video that the introducer needle is being removed. Then the small size dilator sheath is passed through the guide wire. See that. See, the small nick was taken by using 11 number blade. Then dilator sheath is passed. This is a small size dilator sheath. After this we will change it with the large size dilator sheath. You should not enter all the dilator sheath. You have to just enter the vessels inside the vessel. After complete dilation by small and large size dilator sheath, pass the dialysis catheter through the guide wire. Before that, open the one lumen for the passage of guide wire. See the guide wire which is coming through open end of the lumen, that is blue side. Now just simply push the catheter inside the lumen and remove the guide wire. There should not be any resistance. It should go very easily. Then after this you have to check the patency of both the lumen. See, this red color lumen is patent. And always remember, push the NS in a vertical manner so that air will not go inside the lumen. See this. While aspirating, you can aspirate it in a horizontal position, but while pushing it, it should be in vertical manner, and never push the solution completely, so air will not go inside. It will remain in the syringe. See, this blue color is also patent. After confirmation of both the lumen patency, fix the catheter by using non-absorbable suture material. Here we have used the nylon 20. See, here the suture is being taken. After suturing, you have to apply the sterile dressing. See this. The suture is taken over the one side. Same suture is taken on the other side. Sterile dressing was done. Then cover the tip of lumen by sterile pad. This is how you can develop your skill for central line placement only in 4 steps simply. First one is the assessment of the patient, second one give a appropriate position to the patient, and third one is the equipment and the trolley that you require during the procedure, and last fourth one is the main procedure. If you like this video, please do subscribe Ayurveda Tech YouTube channel and share it with your friends. Thank you.